Why does your labor and delivery nurse, midwife, or obstetrician tell you exactly how you should push your baby out? When your healthcare provider is guiding you through your pushing, this is called directed pushing, and it is usually done for a reason. We don't always like to do directed, guided pushing, but sometimes it is necessary for the health and safety of you and your baby. During the second stage of labor, which is the pushing stage, sometimes the baby's heart rate can drop, and they like to be a little bit naughty at this stage, not all the time, but most of the time, and it is because they are being squeezed. They are being squeezed through the birth canal. And if you were being squeezed, your heart rate wouldn't be very happy either. If this is the case, then we don't want it to go on for hours and hours. We know that the baby has a certain amount of reserve and they are able to tolerate a certain amount of this drop in heart rate, but not for a long amount of time. So in order to expedite the pushing process, we want you to do what's called directed pushing. And this is when you fill your lungs and you take a big deep breath and you hold the breath and you bear down into your bottom almost like you're having a bowel movement. And usually you do that 3 times per contraction and then you get a break in between. I have been in certain situations where we are even pushing when you don't have a contraction. And this is just because the baby's heart rate is low and we are almost at delivery and we just want to get the baby out. Of course, I know a lot of you are going to say this kind of pushing is unnatural and it is against what the body actually wants to do, and you should be allowed to breathe and make any kind of noise, and this is an outdated way of delivering a baby. I hear you, and I would love to be able to do what's called open glottis pushing or, unguided pushing with all of my patients, and I usually get to do that, but there are times when we need to do guided pushing, and it is just because, again, your baby's not happy and we need to get them out a little bit faster. And if you are pushing really, really well in an unguided manner, then I wouldn't change a thing. But most of the time, especially if you have an epidural, you do need a little bit of guidance as to when and where to push.